discoloration.
Okay.
So which is why we call it the medical word.
Pigmentation
Exactly.
that we are seeing.
So the medical word will refer to that kind of a rash as a maculopapular. The macule means that it's a flat but change in coloration.
Okay.
While the papules mean that it's
they are raised. Okay.
And the raise is so that you will see the office pin, the head of the office pin. So this is like the size of the head of the office pin. However, the rash might not be typically observed in the black children. That's another
like
thing.
This little girl is not showing up so well.
So you tend to appreciate it better in a light-skinned children.
Okay.
So this rash by 3 to 5 days will have spread. By 2 to 3 days will have spread to the leg. The same progression that it started from is the same way after 2 to 3 days, or that you also follow to clear up again.
Okay, so it starts clearing up from the feet, the body?
No, it starts from
the ears, yes.
So it will also follow the same process. Start
to clear up from the ears, the face, the neck, like that. It doesn't all go at once.
No. So it follows that process of disappearance too. And again, one thing about the rash is very itchy. So which is also what parents will also look at.
But you know that chicken pox itches too.
But the type of rash you see in chicken pox is not what we have just described. In chicken pox, you will see some that are swollen, bigger than the office. Though you might even see the pin head, but you see also some contains water. Some does not contain water. Some will have even busted. So which differentiates.
So it's very possible to recognize the rash.
Very possible.
At the point that maybe the mom or the dad is recognizing the rash, is the child still safe? Is there time to act?
You mean to other unsuspecting children, or to that child?
No, what I'm saying is that eventually you take this child to the hospital. Should the parent be calm and know that, okay, I have time enough to reach the hospital and deal with this? Or is it a time to say,
no.
Almost give up?
See, whether the child presents during the prodromal phase or presented during the phase when the eruptions that come up, one thing again is that we need to emphasize is what the outcome of measles depends on, one, the nutritional status of that child.
Okay.
Then two, the immunizational status of that child.
Now, speaking about that, we've gotten far in handling and tackling these measles according to the statistics we just saw, but there's still a lot of people dying. Is it because the coverage is not total, or is it that some people who have been immunized are still getting measles?
I think we have to first of all look at it from the immunization coverage. Though in recent times, based on available statistics, there have been improvements in the immunization coverage in the country and outside the country to some extent. But again, don't forget so many other things. So many factors even comes to the immunization that we are talking about. Even at that coverage, there are still large number of children that are still not being vaccinated against measles.
Let me ask you, why is that so? Because it is almost the easiest thing to have your child vaccinated if you have your child in a hospital these days.
Yes. For some of us, the same way you are worried, because I practice in an unbound center located within the state capital, and even at that, we still see some mothers coming to the children clinic by 2 years or more in this modern age, and they will say they've not given so immunization. And one of the excuses
Doctor,
they give...
I'll have to ask you to hold your thought there. We have to go on a break right now. We'll be taking a short break, and we'll be back after now. Stay with us. Welcome back. It's Health Matters, and it's time to interact. The number to call is 01-2206-842. That's 01-2206-842. While the discussion continues, you can call in. So we were talking about how, even though we've made a lot of gains on tackling and attacking this disease, so many people are still dying from it. You said, you were saying that some people bring an older child
Yes.
for vaccination.
See, let me make this point known. One of the things we find out is that, don't forget that measles, if you look at our routine schedule, the last immunization visit by mothers is that measles.
Measles, yes, and
So,
probably yellow fever.
It's given simultaneously. So some mothers, for one thing, maybe about that time, the child or the mother has a reason not to have come for that appointment. And they thought because they have missed that appointment that that child can no longer take
The
that
vaccine, okay. So they don't come anymore.
So they are possibly must have taken the vaccines before the measles. So they will now assume, since they missed the appointment. But I think we should let them know that it's wrong.
So
That
if
time that they gave to them is the minimum time that they should report for the next dose.
which means they can come after
Exactly.
if they miss it.
So if it's last month that the child ought to have come and they missed it, and they came back from the village or wherever they went to do one ceremony, because you know in this part of the world we enjoy ceremony, and most of the times we don't really have time to plan for those ceremony, and when it comes,
So-
it takes priority.
Yeah.
So if they had gone for those ceremony and they have now returned back, then the
They
child
should
is
still
still
visit.
eligible. So they should still visit. So that appointment that was given to them, and that is applicable to all the other immunization appointments too. So that was the minimum return time. So they can still go.
For
and
the
child will
visit.
still be
Now,
vaccinated.
I've heard that some countries give 2 doses of the measles vaccine, but I've never heard of 2 doses in Nigeria. Is it not necessary to have a second dose?
Well, it's a general recommendation, so I won't say it's not necessary in Nigeria, or I won't say that maybe it's an issue that has to do with country. It's a general acceptance, or it's a general recommendation that a child requires 2 doses of measles vaccines.
The first would be at
The
9 months.
first to be given at 9 months, though there are still issues as to whether to even drop much lower than that 9 months. But however, let's put it, the first at 9 months.
And the
Then
second?
the second one, which is usually given as a combination vaccines, the triple vaccines, MMR,
Okay, that's measles, mumps, and rubella.
which is usually given by 12 to 15 months
Okay.
of age.
Now, I know that many mothers give the first dose.
Yes.
Why don't they take the second one? Why don't we even know about the second one, commonly?
You see, when we talk of vaccines, we have what we call routine vaccines. That is the vaccines that the government has subsidized, which are given routinely.
Okay.
And then we now have what we call like an advised vaccines. Those are vaccines that are actually important in that child, but however, they are not part of the routine vaccines.
Okay,
So
so
if you
the
look
mother
at
is
our routine,
advised to take it.
yes, so the
But
mother
the
is
hospital
advised.
doesn't have to give it routinely.
Exactly.
But do they advise the mothers, come back with your child or take your child at 15 months and do the combination vaccine, the MMR?
You see, I think this is where we, the health workers, might really have an issue, in the sense that I think we tend to be more regimental. As I said, the routine schedule ends at 9 months, and which is what most health